I am very excited to have this nice gentleman here today. He is a wonderful guy and he's 62 years old. And he's had this friend for about 40 years, roughly 40 years. So now it's time to say goodbye to this friend because this is getting to be too big. So this most likely is a lipoma, and the patient had a CAT scan as well that showed it to be a lipoma. And it is huge, as you can tell, so it's time for this to be removed and bring the anatomy back to normal, to the point where the patient feels really comfortable with this thing and doesn't have to worry about going out and thinking twice. And we'll definitely record it with his permission, just showing only the mass and nothing else, and then we'll take it from there. That's what we'll do. So anybody else who has something like this, please don't wait. There are plenty of surgeons like myself and other surgeons who are willing to help and take care of it. Okay, so let's show you the CAT scan of our patient. It's a huge lipoma. So right here, you can see if this is the beginning. This is the internal jugular vein, and then the carotid artery is right next to it right there. And this is patient's left, patient's right. So start looking over here. You'll see how it keeps getting bigger and bigger and bigger and bigger and bigger, and just goes on and on and on right there. So this thing is huge right there. Good thing it's lipoma, so it should be relatively easy to remove, and still have to be careful, but the likelihood of malignancy is very small. That's the best part. And now we are going to show you a different view. That's like looking from below. So that's, you can tell, patient's jawbone, nose, patient's teeth, jaw, tongue, beginning of the neck, and there it is. There it is. There it is. There it is. Very good. We got it. Today we have a lovely 62-year-old gentleman. He has become my friend. He and I had a long heart-to-heart chat. He has unfortunately suffered with this mass for almost 20 to 30 years. And he was afraid of surgery like me. I've always been afraid, I still am. And it's normal, to be afraid of surgery, but don't let things go for that long. You have to address it so it does not become something that brings you down, makes you feel depressed, isolated and stuff. And it's just not worth it. There's plenty of help available, plenty of help. So today we are going to get rid of this thing. This way our lovely patient here can start his life, start living, and have a wonderful, wonderful time. He's a good-looking guy. I don't want to show you the whole face because we want to protect his identity. But he's gonna have a good life. He's gonna be very happy. And guess what? He has a very, very nice cousin. She is amazing. You can't see her because she doesn't want to be in camera, but she is there for him every step of the way, and so am I. So let's make a nice difference. Can I have you put your chin up a little, please? Thank you. So there we go. So this shows you the extent of the mass. As you can see, it's quite large, and the skin is stretched as well. So we will certainly remove it along with the extra skin. This way it looks nice and matches the right side. Fantastic. Let's go have some fun.